How do toxicokinetic parameters help in determining maximum residue limits, MRLs? Toxicokinetic data such as half-life, clearance, and tissue distribution are used to estimate how long a toxicant persists in edible tissues like meat, milk, or eggs. These help determine MRLs, which are legally acceptable levels of drug or pesticide residues. For instance, after administering oxytetracycline to cattle, the drug's plasma and muscle levels are monitored. If it takes 28 days to drop below the MRL, that becomes the withdrawal period to protect public health. What is a Monte Carlo simulation in toxicokinetics? Monte Carlo simulation is a mathematical technique used in PBTK modeling to predict variability in exposure outcomes across populations. It uses repeated random sampling of parameters like weight, metabolism, or enzyme activity. For example, in a swine model evaluating sulfamethazine residues, Monte Carlo analysis helped predict the range of tissue concentrations in population of pigs, accounting for inter-animal variability. This helps regulators set conservative withdrawal times. What is the role of sensitivity analysis in model development? Sensitivity analysis identifies which model parameters, for example, hepatic clearance, renal excretion, most influence toxicant outcomes. It's like asking, what happens if this parameter changes? For example, in a PBTK model of insecticide exposure in cats, altering skin permeability drastically changed predicted blood levels. Knowing sensitive parameters helps prioritize which physiological traits or variables are most critical to measure or control. Why is protein binding significant in pharmacokinetics and toxicology? Only the unbound, free, fraction of a toxicant is biologically active and available for distribution or excretion. Drugs like warfarin are over 95% protein-bound. Even small shifts, for example, due to liver disease or competitive displacement by another drug, can cause dramatic toxicity. For instance, simultaneous administration of furosemide, which also binds albumin, could increase free warfarin, raising bleeding risk. How can PBTK models assist in extrapolating data between species? PBTK models incorporate real anatomical and physiological values, allowing toxicologists to adjust parameters like liver size or blood flow to simulate another species. For example, data on meloxicam in dogs can be adapted to cats by adjusting metabolism rates. This helps in determining safe starting doses or predicting risk without needing immediate in vivo studies for every animal. What is the effect of age on toxicokinetics in animals? Neonates and geriatric animals process toxicants differently. Neonates may have immature liver enzymes, reduced renal clearance, and thinner skin, leading to prolonged half-lives and higher susceptibility. For instance, chloramphenicol can be toxic in kittens due to underdeveloped glucuronidation. In older animals, reduced kidney and liver function can impair clearance, increasing sensitivity to NSAIDs or anesthetics. What are flow-limited and diffusion-limited models in PBTK? In flow-limited models, toxicant movement into tissues depends on blood supply. For example, small, lipophilic molecules like ethanol enter the brain rapidly. In diffusion-limited models, penetration depends on membrane permeability. For example, large or polar molecules like insulin. For example, in a cow exposed to an inhaled anesthetic, uptake into muscle, a slow-flow tissue, is flow-limited, while into fat is diffusion-limited and slower. Understanding which model applies aids accurate simulation. Why do lipophilic toxicants have prolonged half-lives? Lipophilic toxicants dissolve into fat tissues, creating reservoirs that slowly release the chemical back into circulation. For instance, DDT or PCB residues can persist 4 months in fat, leaching out during fat mobilization, for example, starvation or lactation. This slow clearance increases the withdrawal time and risk of residues in milk or meat even long after exposure. How does environmental stress influence toxicokinetic processes? Stress alters absorption, distribution, and metabolism by affecting blood flow, gut motility, hormone levels, and enzyme function. For example, heat stress in poultry slows gastrointestinal motility and alters hepatic enzyme expression, modifying drug absorption and clearance. Stress in lab animals can confound toxicology results by altering pharmacokinetics, which is why consistent husbandry is critical. What is the practical use of PBPK modeling in veterinary clinics? While primarily a research and regulatory tool, PBPK modeling can inform clinical decisions in complex poisoning cases. For example, in a dog poisoned with a sustained-release thiabramine product, A PBPK model could help estimate time to peak levels and duration of hospitalization needed. Though not used bedside, these models guide therapeutic windows, antidote duration, and risk of delayed signs, especially in severe or multi-organ exposures.